Hi everyone, it's Dr. Samantha Benjamin Allen, board certified in physical medicine and rehabilitation, here to talk to you again about another topic. Today we're going to talk about rehab after amputation. How to prepare for a prosthesis. Main things that we focus on when it comes to rehab after amputation are wound healing, edema control, your rehab of course, and then the fitting for the prosthesis. So you'll be measured and a prescription will be created, usually by a physical medicine and rehabilitation physician, that you will bring to a prosthetist who will fabricate your prosthesis based on the measurements and the specifications that the doctor has indicated. Excuse me. And know that everyone who has an amputation does not qualify for a prosthesis, so it's important that you talk to your surgeon about whether your level of function prior to the amputation as well as the cause of your amputation would qualify you to get a prosthesis once you healed. But I'm going to give you some tips that will increase your chances of being appropriate for a prosthesis if you do have an amputation. So wound healing is one. You want your wound to be completely healed without complications, and I made a video about how to care for your wound or your residual limb after amputation that goes into a little more detail. But basically you want to keep the wound clean and dry. You wash it with soap and water daily and you dab dry it. You don't scrub it hard or do anything abrasive that will risk you opening up the incision again. The next thing is edema control. Edema is a word we use to describe swelling and fluid retention in a limb. Now, this is common in most, if not all, amputations, and we control edema by compression. So we either use shrinkage socks or ACE bandages, though ACE bandages have to be used with caution and someone who is, qualified and competent in applying it, because the pressure has to be consistent throughout, and sometimes you risk one area being too tight or too loose, and this can actually affect the shape of the limb as it's healing, and we do not want a misshapen residual limb because this will not fit into a prosthesis properly. So we don't want it to be oblong or bulbous at the bottom. We want it to be conical in shape because that will fit very well into a prosthesis. So we're all about increasing your chances of your highest level of function possible. So we want to make sure that edema is well controlled, and just know that your limb can change in size for up to 6 to 8 months after your amputation. So be aware that if you have a prosthesis, there might be adjustments required along the way, and even up to 8 months, you could end up with a new prosthesis from what you started with initially. And usually people who have gone through a rehab program, once they've been fitted for a prosthesis, start to ambulate or walk with the prosthesis after 1 month of training. Okay, now the next thing I'm going to talk about is the rehab. So in rehab, we basically want to increase mobility, increase your strength and your endurance, because it does take a lot more energy to mobilize when you have an amputation. So we teach you strategies to walk efficiently and build your endurance, preserve your energy, and build your strength. So we work on those hip abductors, adductors, knee flexion extensors, and hip extensors. Though depending on the level of your amputation, some of those muscles won't apply, but those are the ones we focus on for your walking ability. Now, we want to avoid contractures. Those are things that tighten the joint. So flexion contracture is what we want to avoid. So a hip flexion contracture or a knee flexion contracture would leave the joint in this position, which would not enable you to walk efficiently, because once you try to stand up, if you cannot fully straighten out your knee or your hip, you're going to have difficulty walking. So strategies that we use to help avoid these contractures is encouraging you to lie on your stomach or prone frequently throughout the day for 15 to 20 minute increments. Now, this will allow the joint to stretch so that you don't develop a contracture. So when you do stand, you'll be able to stand upright and walk efficiently. Okay? And if you're using a wheelchair, we will put a plank or a wooden board under that residual limb to keep that knee straight. And also, we teach you how to use your assistive devices as you continue to progress through each phase of your recovery. Now, the next thing is the prescription for your prosthesis. As I said, this is usually written by a physical medicine and rehab doctor, so you want to have one on your team early in the process so they can work with you throughout the different phases, and you'll get the prescription for your appropriate level of function, and you'll bring this to a prosthetist who you'll work with to continue your journey as your limb changes. As I said, up to 8 months after surgery, you can still have some shrinkage of the limb, so you might need a new socket or more socks to make sure that that fit is snug and that the prosthesis isn't shifting and rubbing or causing any injury to your limb. I will leave some links in the comments with more information to support you on your journey, and I wish you well. If there's any more topics you want to hear regarding this, just leave it in the comments and I will try to make a video to help answer your questions. If you are a person who is struggling after amputation or severely debilitated and would love to achieve increased mobility, function, and quality of life, I invite you to join me at Freedom Wellness Physiatry by booking an appointment, and you will work with a physician committed to seeing you thrive and see the possibilities that lie ahead no matter your circumstances. Thank you and have a great day. Talk to you next time.